Hi, I'm Dr. Green. Welcome to MedTwice. I want to talk today about 6 very common mistakes that people make in pregnancy. First one, not using safe medications. Now, I totally get it. People are afraid they don't want to hurt their babies, and medications are scary because they're, some kind of chemical or foreign substance that you're taking in, and you're worried about what it's going to do to your baby. And that is very true, but you've got to understand that number one, when a physician prescribes you a medication and they know you're pregnant, they're being very careful to choose a medication that's safe for your baby. And number two, there's a lot of over-the-counter medications that are known to be very safe in pregnancy. And so there's no point denying yourself the benefit of these very important drugs that can help you and sometimes even help your baby. One very common thing that I see are people that have a urinary tract infection. So a pregnant lady, she gets a urinary tract infection, maybe it's a Saturday or a Sunday, and she goes to the urgent care. And they do a urinalysis and they say, you have a urine infection, you really need antibiotics. And she says, well, but I'm pregnant. And the doctor or the nurse practitioner at the urgent care understands that they're pregnant and writes them for an antibiotic for them to take to relieve the urinary tract infection. And then what happens is the patient waits till Monday, she calls the office, makes an appointment, comes in, and she hasn't taken the medication because she's afraid and she wants to hear it from me that the medication is safe in pregnancy. If a healthcare professional is providing you that medication and knowing that you're pregnant, I can already tell you the medicine's safe. The problem is that many times, particularly in pregnancy, a urinary tract infection can turn into a much more dangerous disease, something called pyelonephritis or a kidney infection, and that can really put you and your baby at risk. So by not taking that medication for a couple of days to confirm with your obstetrician that it's actually safe, you're really putting yourself and your baby at undue risk by not getting that infection treated right away. So that's a really important thing. Trust your healthcare provider when you tell them that they're pregnant, that they're going to be careful in choosing correct medications. Another very common example I see are women that are on thyroid medications or other medications chronically, and they'll go see their family doc. Their family doc knows that they're pregnant. They prescribe them thyroid or maybe change their thyroid dose, but they're afraid to take the medicine until they talk to the obstetrician. That's a really dangerous thing to do because that thyroid needs to be treated with the thyroid medication, and by not treating it, again, you're putting yourself and your baby at risk. So trust your healthcare provider when they know that you're pregnant, that they're writing you for medications that are safe. Now, the other thing are over-the-counter medications. These aren't quite as dangerous. This is more of a quality of life issue. I mean, just because you're pregnant doesn't mean you can't get a headache or can't get a cold or constipation or something that's commonly treated with over-the-counter medications. Most over-the-counter medications are perfectly safe for you and your baby. And so there's no point suffering through these things. I mean, pregnancy is hard enough without having to deal with the normal stuff that you would treat with an over-the-counter medication. My wife and I have a rule at our house. Neither one of us are allowed to complain to the other about having a headache unless we've already taken something for the headache and it didn't work. So if you haven't taken your Tylenol, it's not really fair to complain that you have a headache. There's a whole list of medications that are safe in pregnancy. You can talk to your obstetrician about that, or you can go to medtwice.com, and there's a whole video on over-the-counter medications in pregnancy. But things like Tylenol and most cold medications, as well as constipation and antacids, most of those things are safe in pregnancy. So don't hold those while you're pregnant. Go ahead and make yourself feel better. Number 2, not wearing seatbelts. This is a common mistake that people make in pregnancy, and it's really a very dangerous mistake. People get this idea that because, their tummy's out to here, that the seatbelt is going to hurt the baby if they're in an accident. Actually, that's not true. The seatbelts make it much safer for you when you're in an accident. And so by not wearing a seatbelt because you're afraid you're going to hurt the baby, you're really putting your baby at risk. The way I like to think about the way the baby is inside there, this baby is very, very well protected. Imagine that you order a little ring on Amazon, and it comes in, how it is, it comes in some giant box, right? And so you have this huge box, and inside that box is all kinds of packing material to keep the smaller box safe. And then you open the smaller box, and then that is wrapped up in a bunch of tissue paper, and then you open that up, and then the ring is wrapped up in some kind of cloth, and then inside is the little valuable ring. Well, that's where your baby is. is. Your baby is protected by multiple layers of protection to keep it from getting hurt in case there's trauma. Doesn't mean it can't happen, but the baby is in there and is very well protected. The seatbelt, when worn correctly, is designed to protect you and the baby in case of an accident. And believe me, it's a lot safer for your baby to be held in place by a seatbelt in an accident than to be thrown all over the car. So wear your seatbelt. It's really important for you and your baby. The third common mistake I want to talk about are drastic diet changes and following fad diets. Also using supplements. Now, here's what happens. Most of us, we're not, healthy all the time, certainly with our dietary habits. And women get pregnant, and then all of a sudden they realize, hey, I've got to become healthy. And so maybe they're overweight, and so they go on some huge crash diet to try to, make things safer for the baby. Well, that's not a good thing to do, especially if it's a fad diet. Really, you want to try to eat healthy. So let's say that you're overweight, and you really want to, lose some weight in your pregnancy. The truth is, if you just keep your weight at the same level throughout pregnancy, 6 weeks after you deliver, you're going to be about 20 pounds down, because you're going to gain about 20 pounds of weight just from increased fluids, increased blood volume from the baby, the placenta, the uterus grows. All these things are going to go back to normal 6 weeks after you deliver, and that's going to be about 15 to 20 pounds for most people. So if you can keep your weight the same throughout pregnancy, that's the same as losing about 20 pounds, which is a pretty healthy thing to do over the course of 9 months of pregnancy. What you don't want to do is try to lose a tremendous amount of weight while you're pregnant in most cases, unless you're doing this under the advice of your obstetrician. That can really harm the baby by starving it of the nutrients that it needs. Now, there are some exceptions. Let's say that you develop diabetes in pregnancy. Well, then there's a very specific diet that you're going to need to go on. Again, you're not going to lose a tremendous amount of weight on this diet, but you're probably going to stay about even or maybe lose a few pounds. That's not a fad diet. That's a specific diet for that medical condition. So that would be something that you would want to be on a really drastic diet change. However, for most people, when they get pregnant, if you just try to eat a normal, healthy diet, eat the amount of calories that you need just to maintain your weight, that's a very healthy and safe thing to do. Now, let me talk a minute about supplements. People take all kinds of dietary supplements, and the truth is, most of these supplements, if not all of them, have not been tested for safety in pregnancy. So we really don't know whether they're safe or whether they're going to harm your baby. And there have been some supplements throughout the last few years that have been found to cause problems that we didn't know about until enough people took them. So I would really stay away from dietary supplements when you're pregnant, if for no other reason that we really don't know whether they're safe or whether they're not safe. And the advantage to the supplements is not going to be worth the risk of harming your baby. So that's a really important thing, is what you do with your diet when you're pregnant. Again, just try to eat sort of normal, healthy diet. Don't go on some fad diet where you're eating all of one thing one day or all of another thing another day, or you're completely cutting out a complete area of nutrition. That's not a very healthy thing to do for you and your baby. Eat healthy, eat normal. Try to limit the amount of weight gain. I always say, don't give in to all your cravings, but, every now and then giving into a craving is an okay thing to do when you're pregnant. The fourth big mistake that we see pregnant women make are forcing yourself to sleep on your left side. This is a really common thing. There's this thing out there that you'll see that it's safest to sleep on your left side. This is one of these things that may be technically true in principle, but in reality, when you look at the practical aspects, doesn't really help in most situations. And let me try to explain this just from the basic rationale of why this advice is given in the first place. So we have to talk a little bit about the anatomy, how your body is put together, to understand how this works. There's a big blood vessel called the vena cava that's responsible for returning most of the blood from the bottom half of your body back to your heart. That vena cava lies way back in your abdominal cavity, or really behind your abdominal cavity, so it's underneath your uterus. And it lies pretty close to the midline, but just a little bit to the right of the center behind your uterus. And so the idea is that If you lie in such a way when your uterus is big that the uterus sits right on the vena cava, it's possible for the uterus to occlude the vena cava. Think of it like stepping on a garden hose. And so if that happens, it can decrease the amount of blood that returns to the heart and can cause problems. So it can cause low blood pressure, and ultimately that can affect the baby. And so because this blood vessel is just a little bit to the right, if you tilt yourself to the left, you don't have to tilt quite as much to the left to get the uterus off of that blood vessel. And so that's why we talk about moving people to the left. And we'll use this in certain situations where it's really important. Let's say, for instance, that somebody's having surgery. In that case, their body they've lost control of their body and the sensations and the feedback that the body's given, and so we'll put them on the left side. Or let's say we arrive to the scene of an accident and there's a pregnant lady that's unconscious or in trouble. In that case, we'll want to tilt her over to her left side because that will help increase blood flow. So in those situations, this is a very important thing. But that's not what we're talking about. We're talking about when you're asleep. And so when you lay down to go to sleep, it is true that if you lie flat on your back, there is a chance that that problem is going to happen where the uterus is going to occlude or going to sit on that blood vessel and decrease the blood flow. But if you think logically about what happens and what you'll feel when that happens, is if it's enough to cause a problem, your blood pressure is going to drop. You're going to wake up and everything in your body is going to tell you to move. And of course, you're going to listen to that. And that's going to happen before you have any harm to the baby. So the rule of thumb is, if you're laying in a position that's comfortable for you, you're not causing your baby harm. For some women, they just can't sleep flat on their back and they need to sleep on one side or the other. The difference between the left side and the right side is very subtle, and so if you're at all tilted one way or the other, you're going to be enough to solve that problem. But for most women, it never really becomes an issue, and your body is going to warn you well before there's a problem. You'll move, and the problem's avoided, and there's no harm to the baby. So my advice is, don't worry about whether you're on your left side or your right side, or on your back, or sleeping on your tummy if that's comfortable for you. Sleep however is comfortable for you, and that's going to be safe for you and your baby. So if you wake up and you find yourself lying flat on your back, don't panic. As long as you feel okay, no harm, no foul, you haven't hurt anything. So you can relax, sleep however is comfortable. It's hard to get comfortable when you're pregnant. If you can find a comfortable position, that's great. Use that. Number 5, giving up your exercise routine. This is another very common mistake I see, particularly when people come in for their first pregnancy visit. So somebody is going to the gym, they're healthy, they've been exercising, maybe they've been running on the beach, whatever that exercise routine is, and then they find out they're pregnant and they panic and they're like, oh, I don't want to hurt the baby, and they stop exercising. That's a big mistake. Keep living your healthy lifestyle. If you're exercising, whatever level of exercise you've been doing, you can continue to do that in pregnancy. I've had professional athletes, I've had a couple of professional bodybuilders in my practice, and they've been able to continue to do their thing throughout pregnancy. In fact, I had a tennis pro who worked throughout her pregnancy and 3 months after delivery won a big doubles tournament. So there's no reason you can't keep up a very high level, even of competitive exercise, if that's what your body's already used to. A couple of things about that. Now let's say that you haven't been exercising and you get pregnant and now all of a sudden you decide, gee, I need to get into shape. Exercise is fine, but don't try to start at a competitive level of exercise, even if you did that years before. That's a mistake whether you're pregnant or not pregnant. Just like any advice I would give any person, whether they're pregnant or not pregnant, if you're going to start a new exercise routine, start slow and gradually work yourself up. Listen to your body, listen to the feedbacks of your body. Particularly when you're pregnant, listen to your body. I would not advise working yourself to complete exhaustion. Leave a little bit in the tank when you're pregnant, and if you do that, it'll be perfectly safe for your baby. What types of exercise should you avoid when you're pregnant? As you get farther along, late second trimester, third trimester, when you're really showing, you probably want to avoid things where there's risk of heavy contact against your abdomen. So, playing baseball, probably not a good idea. Playing football, wouldn't advise it. Probably wouldn't advise roller derby or wrestling, when you're really showing, because you don't want trauma to your abdomen. However, hard exercise, working on an elliptical really, in a really challenging way, bodybuilding, lifting heavy weights, that's totally okay, and you're not going to hurt your baby. You may find that as you get farther along, you're not going to be able to perform as well as you once could, and that would be normal. Don't push it. Listen to your body. But keep up that exercise. It's good for you. People that are continuing to do regular exercise when they're pregnant have a much easier time at delivery, because believe me, pushing that baby out is a real workout, and it's going to help if you're in pretty good shape when that time comes. So keep your exercise routine up. If you want to start an exercise routine, just like anybody, start slow and work gradually up. So that's an important one to keep yourself healthy. And number 6, and the last and most important mistake that people make in pregnancy, is getting information from unreliable sources. And boy, this is really common. Look, I know your Aunt Tilly had 6 kids, and boy, she knows everything there is to know about pregnancy. Well, that's great, and you can listen to her and smile and nod, but I wouldn't take your advice from your Aunt Tilly unless she happens to be an obstetrician. Because whatever she does, I'm sure she knows a lot about it, but just because she's been through it a few times doesn't mean she knows all the ins and outs of what's important with pregnancy. Be really careful about the information you get on the internet. And this is coming from somebody who's talking to you from the internet, including me. So check your sources, make sure they're reliable, check the information, make sure it makes sense and that it adds up with what's going on. And please listen to your obstetrician first. So anybody that's giving you information on the internet is giving information to a very broad and general audience. Everybody is unique and individual, and your issues are going to be subtly different than somebody else's issues. Your obstetrician knows you. They know your past medical history. They know your medications. They know a lot of things about you that I can't possibly know from this side of the computer screen. And so the advice they're going to give you is going to be tailored to your individual situation and is going to be better than any advice I give you. Now, I can tell you that the things that I'm talking to you about, I give this advice to my patients in real life every day. And so this is good, solid medical advice coming from a board-certified OBGYN. But again, your obstetrician knows your individual situation, and that's going to be important information. So that's about me, but let's take this a step further. You go on the internet and you read something on a website that looks like a very impressive website, and they have a name that sounds like they really know what they're talking about, but you still don't know who's making that information. It could be some high school kid who knows how to do web design, and that's who you're getting your obstetrical information from. So be very, very careful about that. And this is the interesting thing. This is basically why we made Med Twice. And I'll tell you the story because I think it's kind of funny. So my son, who is a computer programmer and does web design, was looking for medical information and got very frustrated that he couldn't find information that he felt was trustworthy because he didn't know where the information was coming from. And so he came to me and he said, "Dad, you're an OBGYN. Why don't we make a website where you talk to people and they can see your face, look you up and see that you're a board certified OBGYN. At least they know where the information is coming from and that information is reliable." I thought it was a great idea. It's been very helpful in my practice because it's a place I can send my patients to, and I can feel comfortable talking to y'all with the caveat that listen to your obstetrician first, that the information I'm giving to you is good information and reliable information. So those are the 6 mistakes that people make in pregnancy. I hope this has been helpful. I hope it makes your pregnancy a little bit easier and a little bit safer. Thank you, and continue to tune in to our Med Twice videos.